بداية يطيب لنا أن نستضيف رئيس قسم الأورام وأمراض الدم بمستشفى برجيل بسلطنة عمان، الدكتور رامز رياض الباقوني. يسعد صباحك دكتور.
شكرا أخ عبد اللطيف. بداية أنا بحب وجه تحية بهذا اليوم العالمي للسرطان لكل مرضى السرطان بالعالم، ولمرضى الأورام والسرطانات اللي شفيوا من مرضهم، والمرضى اللي اختاروا أن يواجهوا مرضهم بشكل شجاع وبشكل متأمل به وبكل أمل، وحاليا هم برحلتهم العلاج وندعو لهم نحن دائما بالشفاء العاجل. سؤالك مهم بعدة مناحي أخ عبد اللطيف، باعتبار أنه نحن من عدة سنوات فتح معنا قسم الأورام في مستشفى برجيل، وهذا القسم هو القسم الوحيد في المنشآت الخاصة الطبية الخاصة اللي بيقدم الخدمات التشخيصية على مستوى سلطنة عمان. بيقدم الخدمات التشخيصية والعلاجية لمرضى الأورام الصلبة وأمراض الدم. فنحن في اطلاع دائم على آخر المستجدات التشخيصية والعلاجية، ومنعالج مرضانا بحسب الإرشادات العالمية بمختلف أنواع العلاجات اللي ممكن نحكي فيها هلأ بسؤال لاحق إن شاء الله.
دكتور، كما هو معلوم بأن 4 فبراير هو اليوم العالمي للسرطان، ما هي أنواع الأمراض السرطان التي تعالجونها بالقسم لدينا هنا في مستشفى برجيل؟ وهل لا زلنا احنا ولا يزال المريض بحاجة إلى السفر للعلاج للخارج لتلقي الرعاية الطبية الأفضل، أو شعوره أن الخارج ربما يكون العلاج متوفر ومتاح ومتقدم أفضل عن ما هو موجود لدينا هنا في سلطنة عمان؟
نعم، الحقيقة هو أنه نعطي يوم واحد للسرطان هو ك4 فبراير هو يعني في بخس في حق المريض، يعني لأنه كل يوم المريض عم يتعالج، أو مثلا عنده من يوم اللي تشخص فيه المرض عنده، فهو كل يوم متأمل بالشفاء، فهو كل يوم بيتجه في نحو رحلة الشفاء. هو يوم يستحق الاحتفال به. بالنسبة للشق الثاني من السؤال، صراحة نحن في قسم الأورام في مستشفى برجيل بنعالج كل أنواع الأورام الصلبة، أو أغلب أنواع الأورام الصلبة وأمراض أو أورام الدموية، منها سرطان الثدي بشكل أساسي، سرطان الكولون أو سرطانات الجهاز الهضمي، المعدة والكولون إلى آخره، البنكرياس، الكبد، سرطان الدماغ. في كل هذه الأمراض نعالجها، وأيضا نعالج أمراض اللوكيميا، الأمراض سرطانات الدم.
كل دكتور، كل هذه العلاجات للأمراض اللي ذكرتها متاحة في برجيل في الوقت الحاضر؟
نعم. ونحن طبعا علم الأورام بشكل عام
في تطور
دائم. كل عدة أسابيع أو شهرين 3 بنسمع بعلاج جديد أو بأبديت جديد في العلاجات، فنحن على اطلاع دائم بهذه المستجدات، مواكبة المستجدات. كثير من المرضى بيكونوا أخذين علاج معين أو تشخصوا وسافروا للخارج، وقت اللي بيرجعوا لعنا فبيتفاجئوا انه نحن بنقول له نحن العلاجات هي موجوده عندنا ونحن بنمشي بنفس البروتوكولات العالميه.
ما هي نصيحتك دكتور، ما هي نصيحتك للمرضى اللي يفكروا في العلاج في الخارج حاليا؟
لا تسافروا، تعالوا لعنا،
ابقوا معنا في عمان، العلاج متوفر وموجود بفضل الله.
باذن الله نحن بنعمل جهدنا، والخدمه اللي بتحتاجوها او بتطلقوها في الخارج ممكن تطلقوا افضل منها في قسم الأورام في مستشفى برجيل.
Now let's turn to Dr. Ashok, our consultant medical oncologist. Dr. Ashok, could you please elaborate on your approach to advance oncology treatment and how it impacts patients?
Certainly. Here in Burjil, we have access to all sorts of advanced treatments in oncology. Not only conventional chemotherapy, but also targeted therapy, immunotherapy, and so on. We have tie-ups with other hospitals as well, like government hospitals like Sultan Qaboos University Hospital and Cancer Center, where we can get advanced imaging techniques like PET-CT scans done at an affordable rate. On top of that, once we formulate a plan for the patient, we explain that to the patient, and we are able to provide all advanced medications required for the treatment of oncology to the patient at Burjeel Hospital. The impact that it creates for the patient is that he can be secure and safe in the knowledge that he can get all treatments that is required for his cancer, for his malignancy, at one center, that is our hospital, that's Burjeel Hospital. And he does not need to travel to another hospital or outside the country for whatever treatment that cancer requires.
That is amazing. With such advanced care, how do you ensure that patients feel supported throughout their journey?
In Burjeel Hospital, we believe in a holistic approach. The minute the patient walks through our doors, we treat them as a person, not as a patient, and we look at them not only from the angle of their disease, that is cancer, but we also take into consideration the other illnesses that they may have, like diabetes or hypertension. We take that into account. We obviously, when a patient is getting a diagnosis of cancer, it leads to a lot of psychological stress. So we try to alleviate that with psychological support. There are certain nutritional requirements that some patients may be having. So we have a dedicated dietitian and a dietetic team that will look into the patient's nutritional diet and make sure that they're getting a wholesome, balanced diet, which is helpful for the patient as well as for supporting our treatment modalities that we're going to give to the patient. We also look into the fact that some of them might need some amount of rehabilitation, physical therapy, and we take care of those needs as well. And of course, we provide a lot of educational materials so that they can learn more about their disease and they can be more prepared for certain side effects that may occur during the course of the treatment, some of the outcomes of the treatment, and so on. So we look at the patient as a whole, we look at the person as a whole, and treat the person as a whole.
World Cancer Day is all about raising awareness and encouraging prevention, early detection, and treatment. Dr. Ashok, what your advice would you give to all of us cancer prevention?
So World Cancer Day is a day that's commemorated every year on February 4th. It's a day in which we try to raise awareness for cancer. Primarily, we try to tell the people who have had cancer and who have had loved ones who have had cancer that this is not a disease to be feared, but this is something that we can treat and we can improve their condition. So every 3 years we have a certain slogan for the World Cancer Day that changes every 3 years. So from this year onwards, the slogan is United by Unique. What it means is that every patient's struggle is unique. Every patient's struggle through cancer is totally different. You can have two patients who have the exact same breast cancer, the exact same grade and stage and all that, but their journey will be totally different. The way they may receive the same chemotherapy or targeted therapies, but the way they respond to that treatment will be different. The way they go through each stage of that treatment, be it surgery or chemotherapy or radiation, will be totally different. So what the organization that commemorates World Cancer Day is called UICC and the World Health Organization. So what they're trying to say is that you should look at the patient as a person and individualize your care to them and make sure that each person receives individualized cancer care, and to treat each person as their own individual. At the same time, to use the collective information or the collective experiences of all our cancer patients as a united stand so that we can develop better treatments for the future upcoming patients as well. So that is the theme of World Cancer Day this year onwards on February 4th. Also a word about prevention. Cancer prevention is relatively simple. We have certain cancers in which we have early detection. For example, in breast cancer, we have yearly mammograms for all women above the age of 45. For colon cancer, we have colonoscopy that is recommended for both men and women above the age of 45, once in every 10 years. We also have tests like PSA for prostate cancer detection, and CT scans for lung cancer detection. And for cervical cancer, we have something called as a pap smear and HPV. It's a virus that causes cervical cancer. So these can be told to you by your physician or your nearest oncologist. On top of this, the most important part of prevention is actually having and leading a healthy lifestyle. So this includes not smoking, not drinking, and to have a healthy balanced diet in which you have all your macronutrients that are in the right proportion, and of course maintaining a healthy lifestyle by exercising regularly and maintaining a normal body mass index. So these are the things that we can do to prevent cancer, and this is not only for cancer, it is actually for leading a healthy lifestyle as a whole, which is what we are looking for. That includes heart health and lung health, and also for cancer prevention. So these are the things that we can do to from our side to prevent cancers. Thank you.